This is an advanced Thai massage sequence, working with my knee as the practitioner on my partner's hip and then on my partner's neck. So make sure you have really solid footing when working these techniques, and make sure that you're working not on the kneecap, which is really hard. Work with the patellar tendon, the soft tissue right underneath the kneecap. So that's the point of contact, not the bone, and trust me, your partner will know the difference. Okay? So begin with partner side lying. The bottom leg is straight and the top knee is bent, knee forward in line with the hip. I'm going to start at this part of the hip. So stand over your partner and stand so that you're facing them. You'll know if you stand over your partner and you're facing the other direction, it's not going to work so well. I'm going to bring my right knee to my partner Kaylin, to her Gluteus, Medius, and Tensor fascia lata. So it's just this fleshy part of the glute in between the outer hip bone, which is the greater trochanter, and the iliac crest, the top of the pelvis, okay? So in between these two bony points, there's soft tissue. That's where we're working. I'm going to turn facing away from the camera, facing away from my partner's back. Plant the back foot, and again with the soft part of the knee, make contact first, and then gently sink down. Is that pressure okay? Mm-hmm. Yeah. So it's the weight of my hips sinking straight down. I have sure footing in the back foot, and I'm grounding through the heel of the opposite foot, which you can't see. Gently rise up, reposition an inch to the left or to the right, lock, and then sink. My other hand, I could even have a hand on her shoulder, just helping with a sense of grounding. I can bring both hands down to the ground, reposition, lock, and sink. At least 3 points of contact, and then rise and return to the starting position, standing over your partner, facing toward their head. Next, I'm going to turn in the same direction that my partner is facing. I'm going to lock my Achilles tendon to my partner's patellar tendon, not the kneecap, so soft tissue to soft tissue. And this way, when I push on the back of her hip and kind of forward toward her knee, the front knee won't slip forward. In this case, my right foot is locking it in place. So just like we did on the other side, I'm going to pivot on the back foot. My heel is lifted, which you can't see. I'm going to make contact with my knee on her hip, again, not on the bony tissue. Maybe both hands down this time, and I'm going to slowly sink weight down. Is that okay?
Feels good.
Okay. Rise up slowly, reposition, lock, and sink. Rise slowly, reposition, lock, and sink. Is your left hip okay on the ground?
Mm-hmm.
Yep. You can always put another pillow underneath. And we're just working on a plush rug right now, so you don't need anything fancy. Usually I use a mattress topper on the ground. It's best not to use something too cushy because I'm compressing with my knee, and the ground is keeping her. If I were on a bed, then my pressure and her hip would just sink down into the bed and we wouldn't get as strong of a compression. But anyway, compressing not on the bone, on the soft tissue, different points. After that, after I use my knees, I can stack thumb on top of thumb. Find a dense spot. That's where we're trying to work. And then lock and sink. I'm stacking my shoulders and my chest over the point of contact. So I'm not pushing with my arms. I just keep my arms pretty straight, pretty taut. I lock into a dense part, and then I just lean my weight forward into my hands. Okay? Use the palms to soften it out. Maybe even trace down the leg. Remove the lock position and step behind your partner. Next, I'm going to move up to the neck. And this might seem odd, like I'm going to put a knee in my partner's neck, but with her top arm in line with her torso, elbow bent, I'm going to keep, in this case, my right hand and forearm to hold it in place, keeping a broad area that I'm going to work on her neck. There are transverse processes, which basically just means bony protrusions from the vertebra of the cervical spine, the bones of the neck. They stick out to the side. So we don't really want to be right on the side of the neck. We want to be on the side / back of the neck. And if you just massage yourself there, you'll know exactly where I'm talking about, okay? I'm going to use a very closed knee, which makes a nice bulbous rounded tool. I keep the heel of the back foot lifted, but the ball of the foot down. My hips are back, stacked over the heels. So most of my weight is just on my toes here. I make contact with Kaylin's neck close to the shoulder, not on the kneecap, the patellar tendon below the kneecap. My other hand's holding her arm, but I'm not leaning on her. And now I just gently lean forward. Is that okay? Mm-hmm. I lean back to remove pressure, move up a couple inches, maybe bring, in this case, my left hand, the hand that's closer to her head, down to the floor in front of her head. So now I can lean forward now that I have this hand down, and then lean back, remove the knee. One more position close to the skull, where the neck meets the skull. In this forearm, I can even let it hold her forehead in place. So I'm not pushing, I'm just keeping her head from sliding too far off the pillow. Sinking pressure down. This is actually a lot gentler than you think. Rise up. Return to second position at the middle of the neck. Sink forward and downward. Rise, and then first position close to the shoulder. Sink down. And rise up. Use your hand to check and see if the tissue's a little softer than when you first started. All right? And those are the two techniques. More advanced. Be careful. Make sure you have sure footing. Do not fall on your partner. Don't use the bony part of the kneecap. Use the soft tissue underneath it. Happy practicing.